Okay, so first of all, I want to thank you all for attending. We're going to do a quick review of the total gut restoration, but then we're going to talk about the other products that Microbiome Labs have that you may not be familiar with. So you're already familiar with the total gut restoration and the reconditioning that Megaspore does, the reinforcing that Mega Prebiotic does, and the rebuilding that MegaMucosa has, that it does. And we have a lot of documentation that shows how important the diversity is in the gut, and without it, you're more susceptible to inflammatory disease. We're also have a lot of documentation on these keystone strains and how important they are for maintaining the microbiome. And they're protective. They help maintain healthy weight. They help reduce inflammation. And then we've got a lot of good documentation showing that if you have a healthy mucin layer, you're also protected. Your microvilli will be protected, the tight junctures will be protected, and you'll be protected against autoimmune disease. Over here is the example of an unhealthy gut, where these protections are not in place. There's not a good diversity, the keystone strains are not there protecting, and the mucin layer is breached. So you see how the lipopolysaccharide is flooding into the lumen of the cell. It's causing rampant inflammation and a cascade. And this is the source right here of all chronic illness. Your food sensitivities, your autoimmune disease, and it contributes to every disease that we could have. So when we look at lipopolysaccharide, every one of these correlates with a white paper. This has been extensively studied. We know that lipopolysaccharide interferes with leptin and causes leptin resistance. It shuts down the bowels and causes chronic constipation. It causes mood and appetite disorders, depression, cognitive decline, loss of memory and recall, depression, anorexia nervosa, anxiety, chronic pain, Parkinson's, hypogonadism, and low testosterone. And the last one is autoimmune disease. And we knew that if we were to do a human clinical trial, the most important thing we could show is how we could reduce that lipopolysaccharide because of all of those relationships. So we published this in August of 2017, showing that the spore probiotics decreased postprandial lipopolysaccharide as well as other disease risk factors. So this was our land-breaking study that put us on the map. So not only did we reduce the endotoxin lipopolysaccharide by 45%, but we also showed a reduction in triglycerides, in ghrelin, in these important inflammatory markers for autoimmune disease. And then that was only in 30 days. In 90 days, we showed a significant reduction in glucose, in insulin, in leptin, and these other interleukins. And each one of these now are their own independent study and will be published. Now, a couple of new publications that we just had have to do with this SHIME study. And I wanted to just let you see what this looks like. This is the most sophisticated way to test probiotics. So you really want to see what happens in the gastrointestinal tract. So in Ghent University in Belgium, they've created this SHIME, and it mimics the gastrointestinal tract. So as you can see, it's a complete gastrointestinal tract from stomach to colon. We can study the chemicals, the enzymatic, the microbial variables of the digestive tract in a controlled in vitro setting. It includes 5 reactors, as you see right here, that simulate the stomach, the small intestine, and 3 regions of the large intestine, the ascending, transverse, and descending colon. And this, again, is the best way to study the effects of probiotics and how to heal the gut. So we would inoculate this with a healthy microbiome and then feed it probiotics to see how far the probiotics can get into the gastrointestinal tract, and that's how we know an unprotected or a non-spore probiotic can get as far as the small intestine, or get as far as the stomach because of the hydrochloric acid. And then some, 1% that would make it to the small intestine would be destroyed by the pancreatic enzymes and bile salts, and then they work by metabolic signaling. Whereas the spores actually get to the small intestine, colonize, and produce all the metabolites that perform these benefits that we're talking about. So using this SHIME study, the next publication that we have now is the symbiotic concept of the spore-forming bacillus and prebiotic fiber blend. So now we're showing that not only does Megaspore jumpstart the keystone strains, but with the addition of the Mega Prebiotic, we're actually feeding those keystone strains and can increase that amount by 80%. So that means 80% more short-chain fatty acids, and those short-chain fatty acids help increase the diversity of the microbiome and feed those very important keystone strains, such as Akkermansia, which helps with weight control, Faecalibacterium, which helps with inflammation control, and the Bifidobacteria species, which we know have a lot of benefits. So that's just a quick review of the total gut restoration and the publications that we have. Another point to remember is that in the MegaMucosa, there is powdered concentrated immunoglobulins, and these are very effective in neutralizing the endotoxin lipopolysaccharide. But we also sell that concentrated immunoglobulin as a standalone product called Mega IgG 2000, because you might want to use that in very sensitive individuals that you would prefer to pre-treat the gut because they have so many toxins, or they react to everything. They're just some of your canaries or your hypersensitive individuals. It's also important to recognize during flu and cold season that that immunoglobulin is going to help modulate your immune system and protect you. So another study that we now have that's been published is on our one spore probiotic, because this is very powerful to realize how it modulates the immune system. And you see here in the results how it reduces the interleukin 6 by 45% and the TNF alpha by 55%. And this one spore probiotic is a standard of care in Cleveland Clinic for the hepatic encephalopathy ward because it's so effective at reducing ammonia. And that's ammonia is produced in liver failure and is very toxic to the brain and shuts down internal organs. So don't underestimate the other probiotics that can have their own standalone purpose, or if someone has a damaged immune system and can't tolerate all 5 spores of Megaspore, you could start with the one spore probiotic and work up. And another SHIME study was published. So this is now our 4th publication. And here what we're showing is that the bacillus spores are very effective in treating IBS. And it was shown to treat IBS even better than the pharmaceutical rifaximin. So now you have a nice white paper with more documentation on how these spores perform. This is our 3rd probiotic, and this is the 2-spore probiotic. So it has that Bacillus subtilis, the same that's in the HU58 that reduces the interleukins and the TNF alpha. It also has the Bacillus clausii, and it has Saccharomyces boulardii. So this is going to be a real nice formulation for those that you know have candida, or that are going to go on to antibiotics, or are on antibiotics, or post-antibiotic recovery. And you can see you can add this to the Megaspore if you have extreme overgrowth, such as SIBO or C. diff. And then this is one of the newer formulas that we have, and this is very effective against candida. And the reason is because it uses undecalinic acid and B-propolis. And you'll see that the way that candida is so damaging to the gut is because it produces hypha. Hypha is like roots that dig down into the epithelial cells and destroy the tight junctions. And you can see that in itself is going to cause leaky gut. So what undecanoic acid does is it stops this hypha development. So that way the candida will just pass through the colon, pass through the gastrointestinal tract. And you can see here how antifungal undecanoic acid is to the candida. So this is an effective formula, but you do, like all of our other products, it's very strong, and you want to titrate it and start very slow. The recommended dose is 2 soft gels 3 times a day, but I would start with 1 soft shell, well, as it says here, start with 1 soft shell daily, and then 2 soft gels the second day, and work out from there, because you don't want to cause too much exotoxin release from the candida and overwhelm. If there is some exotoxin release, remember that Mega IgG 2000, it's very effective in neutralizing candida exotoxins as well. So it has several purposes. And then this is one of our newer products as well, and very effective for upper digestive problems such as GERD, dyspepsia, H. pylori, and sluggish bile flow. And it can be very helpful for those who don't have a gallbladder, and it keeps that bile flowing. And we know from the most recent IAACN conference, we had a great lecture on phase 2.5 detoxification, which they're now realizing is very important and involves bile salts. Bile is very antimicrobial, and it helps control the gut dysbiosis. And if you don't have good bile flow, you're going to have more dysbiosis. And if you have more dysbiosis, the bile you do have can be unconjugated. And unconjugated secondary bile salts is very toxic and can cause chronic long-term diarrhea. And we've already had some good feedback on this product with individuals with ulcerative colitis and chronic diarrhea, and it's helping immensely. Now, this is our latest launched product. It is called Wheat Rescue. As you can see, it has some of our spores in it and some Saccharomyces boulardii, and it has a blend of very effective enzymes that break down wheat proteins into smaller amino acid sections that are not immunoreactive. And this is very important because we know that gluten and gliadin is very inflammatory. And for individuals that are sensitive to the wheat proteins, they need to have them broken down so that they're not causing that inflammation and they're not reactive. And this will serve as a dual purpose. Once you've worked with someone and you've done the total gut restoration and you've taught them, how to eat and improved their diet and how to avoid wheat and gluten, this will serve as a maintenance for the spores, as well as helping them to eat into, be able to go to restaurants and to cook for themselves, because we know that even those that are trying to follow a gluten-free diet are still exposed to about 30% gluten. So this is just an insurance to keep the hidden gluten from causing damage. This is a nice chart just showing how important vitamin K2 is in bones. And we know that vitamin D2 stimulates calcium and that releases osteocalcin. But it's the role of vitamin K2 to ionize or to carboxylize the osteocalcin so that it goes into the bone. So if you don't have enough vitamin K2, you can't drive the calcium to the bones. And this also serves in resorption. And if you don't have enough vitamin K2, this uncarboxylated osteocalcin will deposit into soft tissue. And that's how you get atherosclerosis, plaquing in the brain with Parkinson's, kidney stones, and gallbladder stones. And we're seeing a lot of these calcifications in soft tissues for several reasons. Vitamin K2 is fermented in the gut. This is a vitamin that's made by your microbiome. And because so many individuals have dysbiosis, they're not making adequate vitamin K2. And you can't get adequate vitamin K2 in your diet. And if you use vitamin D3 without K2, you deplete your K2. The other thing that's important about vitamin K2 is that you must use enough of it, because the microbiome itself utilizes vitamin K2 as an energy source. So most products on the market only have between 45 to 100 micrograms of vitamin K2, and that's just what the microbiome uses. You have to have at least 300 micrograms in order to get the vitamin K2 into your tissue and to reduce these calcification deposit problems. So we have two formulas of vitamin K2. The first is called Megaquinone, and it does all of the things that the vitamin K2 does, with some exceptions. It also has some K1 in it, because the body spares K1. If you're depleted in K1, the body will convert your K2 to K1. So we put a little bit of K1 in there to stop that reaction and to complete your K1 stores. And we have some magnesium and zinc to help with absorption. But what this formula will do is remove the calcium from the soft tissues, halt the bone mineral density loss, protects the brain and nerve health from reactive oxygen species, induces apoptosis in vitro with leukemic cells, reduces risk of prostate and liver cancers, improves insulin sensitivity after 4 weeks of supplementation, and enhances male fertility by increasing testosterone production. MyoMax has the same K2 in it without the K1, without the magnesium, and without the zinc. And this it does all the same things that the other product does, and this is the product that was in the published clinical trial. And we wanted to look for more unique aspects of K2, so we focused on the cardiac output. So what the study showed is that you can increase cardiac output by 19% and increase blood volume. And this is very important for helping individuals with exercise, especially athletes. And this is a side-by-side comparison of the two products. Megaquinone has a little bit more, 20 milligrams more of the K2. Again, it has the K1, it has the magnesium, has the zinc, does all of these things that were mentioned. MyoMax does all of these things that were mentioned as well. With the added study, it also highlights the importance for athletes. It also would be helpful if you have patients that are on anticoagulants, specifically K1 agonists, because of that K1 that is in the complete formula here. So this is a list of some of the universities and centers that we have our ongoing studies that are in progress right now. And we currently have 5 published studies, which has put us on the map. And we have the top of the line SHIME studies, which is the best way to study probiotics. So at this point, because I've introduced a lot of new information, if you want to take yourself off of mute, I'm happy to hear your questions.
So how do you know how much vitamin K you have before you have too much?
The best way to check your vitamin K2 levels is a test called uncarboxylated osteocalcin. And that test is available through LabCorp. But know that they've tested overdosing of K2 and they've not found a ceiling. So the body does rid any excess K2 without any side effects. So you can check to see if you're deficient with the uncarboxylated osteocalcin test, but know that there are no LD50 levels that would exceed a dose. That was a great question, though.
I don't know why I can't take it.
Well, if some come to you later as well, please write them down and email them to me.
What's the difference in the K1 and the K2?
K1 is made in the liver, and that's going to control your blood clotting factors. K2 is extrahepatic. It's the vitamin K that's in your tissues that mobilizes calcium from the tissues back to the bones.
So not everyone uses K1, they use only K2. So the K1 actually is helping them in case of the liver? Is that why you add it?
We add it because if you're deficient in K1, the body will convert your K2 to K1. So we just want to make sure you've got plenty of the K2 available. So we put a little K1 in there to satisfy the liver. Most people get adequate K1 through green leafy vegetables. But if people don't eat vegetables, they could be deficient in K1.
Fat on their vegetables.
I didn't quite hear that. I heard vegetables.
They need the fat with their vegetables, right, to absorb the K?
Yes, that does help with absorption because it is a fat-soluble vitamin. And we've covered this before in previous lectures, but you do want to be careful with individuals that have metabolic endotoxemia and leaky gut and a lot of food sensitivities, and not give them coconut oil until their gut is healed, because coconut oil can exacerbate the lipopolysaccharide and make it more toxic.
Well, that was really good. We really appreciate it.
You're welcome. And like I said, think of those. If you think of any questions, feel free to reach out.
Okay. We'll bring in the second group.
Okay, thank you.
Thank you. Bye. Have a good afternoon.
Thanks, you too.